Hello, my name is Dr. MarkAlain Dery. I'm the Medical Director for Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. You've seen me do these updates now for the past 8 weeks in conjunction with the leadership of the ACOI, and I hope these messages are helping you keep up with the latest on COVID-19. I know many of you are in the thick of this fight, and I'd like to thank you on behalf of all of us who focus on infectious diseases for a living, and certainly on behalf of the ACOI. I live in New Orleans, Louisiana, and I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. As we are facing this once-in-a-lifetime global battle, I want to hear from you, my colleagues, who are experiencing this fight from their locations. No matter where you are in the country, I provide my contact information at the end of each update, so listen for that, and I hope you take me up on the invitation to reach out. Moving forward, together with the ACOI, we will continue to share information as it becomes available, as well as some of the more hopeful progress that we are seeing. Also, for some more information on the ACOI's new peer-to-peer well-being check-in sessions that are also available free of charge to ACOI members, please go to acoi.org/COVID-19 and click on the box so that you can find out how you can join in. These Zoom messages are an awesome way to feel connected and support during this very, very challenging time. So let's talk about something called quarantine fatigue, because we're all feeling it to an extent, right? And the term that is now being coined is called quarantine fatigue. To explain, the term speaks to our growing restlessness at our current way of living, staying home more, social distancing from those that we normally see or hang out with. And this could be family, friends, or even work colleagues. And as humans, we thrive on relationships. And right now, in a sense, we are being starved by isolation through the act of quarantining. Now, admittedly, some of us more than others. Some of us who are essential workers are still out and seeing people, and of course, fully protected and fully respecting one another by wearing masks, of course. Yet others have very limited social outreach and are feeling the isolation so much more. And there's still others who have just stopped quarantining altogether. Their fatigue has turned into what some people would say is called apathy. So how much do humans dislike being alone? Well, there are studies that show that people would rather experience physical pain than experience loneliness. And what's interesting is how some are reacting to quarantine fatigue. Some individuals are showing more irritability, restlessness, and even physical exhaustion. It actually mimics depression in many ways. Some want the stay-at-home orders, or what have now become social distancing suggestions, to be lifted and forgotten, and they are now responding to their quarantine fatigue with anger and with defiance. And they are the ones you are seeing from the photos online who are swarming beaches and parks and are those that are refusing to wear a mask. Now, to help fight quarantine fatigue, it is important to remember why we are all being asked to make these efforts. Being home is not about you as an individual. It's about protecting everybody else. Yes, it means inconveniences and changing our daily routines and, of course, keeping our distance. So as an infectious diseases doctor, what do I recommend on how to manage it? Well, I agree with an article from Psych Central that lays out some suggestions on everything from following the facts and listening to science as a means of staying informed to resisting the conspiracy theories that rise out of the fatigue from social media pundits. From your own mental health, you can also make a point to communicate to others more. You could try FaceTime or Zoom or just a simple old-fashioned phone call, or to volunteer with online committees or organizations with whom you share passion. Battling quarantine fatigue requires the ability to accept and adapt and understand that by doing the right thing now, and also recognize that this is not going to be forever. And please, 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 please help to get the word out that everybody should be wearing masks at all time whenever they leave their house. So now we're going to talk about a grim milestone and Memorial Day. Now, as I'm recording this today on Memorial Day, a day when we remember the sacrifices of those who have fought for our country and our freedoms, Ironically, it falls on the same week as another event, and this should be cause for all of us to pause and really truly reflect. And that milestone is the number of COVID-19 cases that the U.S. has currently logged. And that number, as I'm sure you've all heard by now, is 100,000. The New York Times, in this past Sunday's edition, printed the names of some of the victims of the virus, each representing one of the nearly 100,000 lives that have been lost thus far in this fight. I actually really do recommend that you check it out and read the short snippets that identifies them as more than just a name, but as people who had great-grandchildren or played a saxophone at Denver's oldest jazz club for 40 years, or who was known for his laugh that his family and friends referred to as being exuberant. The digital edition of the New York Times displays the names along with these short phrases about each one, and it uses a scrolling timeline to show the date and the number of cumulative deaths. Now, while many of those who have had it, currently have had it, or who have died from it, are like you and me, ordinary, everyday people living their lives. And I want to call out on this Memorial Day those victims who we honor on this day, and of course these are our veterans. The Department of Veterans Affairs is reporting that more than 1,000 veterans have been killed by the virus, and some of these individuals are World War II veterans in their 90s or 100s. Some are Korean and Vietnam War veterans in their 80s and their 70s. The number of deaths does not include countless hundreds of others who have died in state-run veterans' homes, including hard-hit facilities in states like New Jersey or Massachusetts, or even here in my home state of Louisiana. Now, the toll of this virus on our military veterans has been particularly brutal, and they had many things going against them, being in a high-risk group who are older and perhaps with underlying health problems, and many of whom reside in facilities where the risk is even higher. And as we have all heard, so many of them have died without even having those loved around them. And it is not a fitting death for our heroes, or for anyone who passes from this disease. So I end this with a plea of respect for them, and out of respect for those veterans, and for ordinary citizens like the rest of us who are still here and healthy, do the right thing and wear a mask. This request pales in comparison to what our veterans have been asked to do in the past. Wearing a mask out in public is the least that we can do for them. So, in conclusion, please stay on the lookout for regular updates, and to read more from the sources that have been used in this report, you can go to the acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and to stay on top of this crisis. Also, please feel free to reach out to me anytime at madery@macmac.com. Please stay safe. We can do this together.